terms of jaw surgery recovery, people ask this very frequently, both in terms of the acute aspect or the immediate aspect right after jaw surgery and when they can return to school and work and resume normal activities, those types of things. So jaw surgery in our hands typically takes anywhere from 2 to 4 hours, depending on the complexity. Most of the time we're moving both the upper lower jaw and doing a lot of adjuncts concurrently, and our average time is around 2.5 to 3 hours. We do it most of the time in an outpatient ambulatory surgery center with very close follow-up, with nursing follow-up, and we see you the next day and we see you 1 week later. It's all typically done inside the mouth. You're not wired together, but you do have quite tight rubber bands or elastics holding the teeth together for that first week. The reason being is because we want the muscles to get used to the new position of the bones, but the bones themselves are quite stable with plates and screws that we use that are holding the bones together. The first night, typically, patients are a little bit groggy from the anesthesia, but not really much pain yet. We use a long-acting numbing medicine called Expro that keeps you really nice and comfortable for 2 to 3 days post-surgery. We see you the next day. We obtain a CT scan, make sure things are going well with your post-operative care. The third day after surgery is usually the peak of the bruising and swelling. The first 2 to 3 days after surgery too, there can be a little bit of drippage from the nose that we manage with nasal sprays, and we make sure that you're taking proper nutrition and liquid and blenderized food with syringes or other instruments that can help us get that in there. At the 1 week mark, you're kind of past the bulk of the recovery. The first week is really, the most critical, or the portion of recovery, that people have the most. We see you at that 1 week mark. We loosen the rubber bands, and then you can start opening and closing a bit more. You can get a spoon in, you can get a cup in, and you're kind of out of the woods at that 1 week mark. In terms of other dietary recommendations or our protocol, we usually want you on blenderized food for 3 weeks. So even though you can start opening and closing at that second and third week, we still don't want you chewing. And we want at 4 to 6 weeks, you can switch to soft food. So at that point, you can start chewing a little bit, but very soft food, pasta, scrambled eggs, mashed potatoes, those kinds of things, soups that have very overcooked vegetables. The other main thing that people talk about or we look into is when they can go back to school and work. And I would say the soonest we see people go back is about 8 or 9 days after surgery, but in those cases, it's usually more desk work that you're not talking a lot, certainly not doing any heavy lifting, and maybe working for 3 to 5 hours instead of 8 to 10 hours because you might get tired a little bit sooner. But we see that with lawyers that want to check emails and people that aren't public speaking and doing significant manual labor. The longest is about 6 weeks, where pretty much everybody is back at school or work and can be talking pretty significantly and doing almost any activity at that point. And the more average is somewhere in between, about 3, 4, 5 weeks or so. We see you along the way, though, and you're not fully healed at 6 weeks, but by 6 weeks, we allow you to resume, any exercise and sports. Usually some light activity is fine at 3 or 4 weeks, but no really heavy lifting until 6 weeks. And then we see you at intervals over the next 2 or 3 months until a year. There is hardware in place, and 90% of the time that can stay forever, but some patients may want to have that hardware removed. We typically want to leave that at least for a year, though, to make sure the bones are fully healed and stable prior to removing that hardware. So again, the main behavioral changes and modifications after jaw surgery, number 1 is dietary: clear liquids for the first night, blenderized food for 3 weeks, soft food for 3 weeks. The other thing is exercise and heavy lifting and when to return to sports. No heavy lifting or exercise for 6 weeks, but in terms of some light walking and elliptical and that type of thing, 3 or 4 weeks is okay to get back with that. The other question people have is when should they see their orthodontist? And orthodontists are a little bit different, in particular in terms of when they would want to see you. Some like to see you early, which we prefer because if any of the hooks or elastics need to be changed, they're able to do that. Obviously, too early, they can't see you and do much while you're still healing and swollen. But an important thing is that the teeth move much quicker over these first several weeks and months from surgery with this rapid acceleratory phenomenon response to the teeth, where with some inflammation, they're going to move really quickly. So as early as possible that we can get you to see the orthodontist is ideal. One thing to consider, though, is because of the jaw surgery, sometimes it can be difficult to open and close your mouth for a period of time, which is normal. But if you're an Invisalign or a clear aligner type patient, in order for them to do the scan of your teeth, you need to be able to open a certain amount. And if you can't do that, that might delay things a little bit. But if it's regular braces and they can get in to make any changes, we like to really pursue that as soon as we can. In some cases, muscle relaxants, seeing a therapist, oral motor therapist or physical therapist to help with your opening and opening exercises. Sometimes we can contemplate Botox to the muscles, and all these things will help your return to motion and resumption of orthodontics to be more efficient. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.